guys, so this is the lecture number 1 of tablet dosage form by Excellence Academy. So do you want to know the definition of a tablet? Hey, I'm talking to you. Yes? Oh, it's good. So tablet is defined as a compressed solid dosage form containing medicaments with or without excipients. Here medicaments are used for pharmacological action and excipients are those agents other than the API, means active pharmaceutical ingredients. According to the Indian or Pakistan's pharmacopoeia, pharmaceutical tablets are solid, flat or biconvex dishes unit dosage form prepared by compressing a drug or mixture of drug with or without diluent. Here drug is like paracetamol and mixture of drugs is like if you're having any other drug along with that paracetamol. They are vary in shape, having different shapes and differ greatly in size and weight depending on amount of medicinal substances and intended mode of administration. It is the most popular dosage form. 70% of the total medicines are dispensed in the form of tablet. This point is very important. All the medicaments are available in a tablet form except where it is difficult to formulate or administer. How about the advantages of the tablet? Do you know that? Okay, so they are unit dosage form and offer greatest capabilities of all oral dosage form for the greatest dose precision and the least content variability, means we can have it without any problem. For example, if you want to have the 5 mg dose for BD, so we can have it without any problem. Cost is lowest of all oral dosage form. They are lighter and compact. They are compact because they are from bicompression and they are lighter, thus don't have that much weight. They are easier and cheapest to package and store, means their packaging is also very cheap, easy to swallow with least tendency for hanging out. Sustained release product is possible by indirect coating. Objectionable odor and bitter taste can be masked by coating technique. They can be easily masked. Alright, so suitable for large scale production, greatest chemical and microbial stability. And product identification is easy and rapid, requiring no additional steps when employing an embossed and monogram punch face. Tamper-proof dosage form. Actually, tamper-proof problem is occur in the liquid, not in the tablet. How about the disadvantages of the tablet? They are difficult to swallow in case of children and unconscious patient. They will be having difficulty in swallowing. Some drugs resist compression into dense, compact owing to amorphous nature and low density characteristic. Due to amorphous and low density characteristic, there will be difficulty in the compression of the tablet. Drugs with the poor weighting, slow dissolution properties may be difficult to formulate or manufacture as a tablet that will still provide adequate or full drug bioavailability. Better tasting drugs with an objectionable odor or drugs that are sensitive to oxygen may require encapsulation or coating. In such cases, capsule may offer the best and lowest cost. Patient can't get particular properties of a medicine such as emulsion action of linked dust can't effectively obtain with the tablet. Then we have the liquid medicine can't be satisfactorily formulated as a tablet, means liquid form of the medicine can't be converted into the tablet. How about the ideal properties of the tablet? In which we have a tablet should have elegant product identity while free of defect like chips, cracks, discoloration and contamination. They should have sufficient strength to withstand mechanical shock during its production, packaging, shipping and dispensing. They should have the chemical and physical stability to maintain its physical attribute over the time. The tablet must be able to release medicinal agent at a particular time in particular manner. They should be suitable size, shape for easy administration without any problem. Then we have the types of tablet, in which number A, we have the tablet ingested orally, in which we have the compressed tablet, and the example of compressed tablet is like paracetamol. Then we have the multiple compressed tablet, in which we have the cold drain, repeat action tablet, delayed release tablet, in which we have the intercoated bisaccharide tablet, sugar coated tablet, in which we have the multivitamin tablets, film coated tablet, in which we have the metronidazole. Then we have the type B tablets used in oral cavity, in which we have the buccal tablet, in which you have the example of the buccal tablet is like vitamin C tablet, sublingual tablets. The example of the sublingual tablet is like Vicks menthol tablet, angina pain tablet. And then we have the troches or lozenges. And last we have the dental cone. Then we have the tablet administered by other route, in which we have the implantation tablet, vaginal tablet, in which there is clotrimazole tablet. And at last we have the tablet used to prepare solution. Examples are like effervescent tablet, in which we have the dispersion tablet. Then the other example is dispensing tablet, in which we have the enzyme tablet. Then we have the hypodermic tablet, and then we have the tablet trichurates, in which we have the enzyme tablets. So that was the lecture number 1 about the tablet. So thanks for watching our video.